नमस्कार आपको आपको सबको आमंत्रित है। आज हम आप सोचो कि आपके पास बैठे हुए हैं एंड सुरेंद्र जी ने आप हमको परमिशन दी है बोलने की, तो हम आपका इसका एडवांटेज लेके आप सबसे बात करेंगे। सो पहले तो मैं अपने आप को बताता हूँ। मैं हिंदुस्तान से हूँ, बड़े उजानी स्मॉल विलेज। आई बोर्न देयर एंड देन आई फ्रॉम यूपी आई वेंट टू जयपुर। जयपुर से वहाँ पर पढ़ाई की, मेडिकल स्कूल। एंड देन आई केम टू अमेरिका हियर एट एमरी एंड नाउ आई एम डूइंग प्रैक्टिस इन कार्डियोलॉजी। एंड सुरेंद्र जी ने बहुत सिखाया है। हमारा उनका बहुत बड़ा संबंध है, करीब 30 साल से ज्यादा। और जब भी हमको कोई दिक्कत होती है तो उनसे ही बात करते हैं, ये हमारी सहायता करते हैं। तो आज उन्होंने बोला कि आप मना हृदय के बारे में बताइए, तो हम आपको बताते हैं हृदय के बारे में। एंड उससे पहले आप जाओ तो सबसे पहले आप मैं कहता हूँ कि आप है ना जीवन आनंद में आनंद में जीवन की जो वेबसाइट है उसमें आप जरूर जाइए। और सुंदर जी ने उसमें जो गीता का जो ज्ञान दिया है बहुत ही बढ़िया, बहुत सिंप्लीफाइड, ये बहुत ही बढ़िया किया है। मैंने मैंने आज इट इज वेरी वेरी इम्प्रेसिव एंड वेरी सिंपल। सो इफ यू कैन टीच, and it'll be easier way to teach the children if they know Hindi. So because it was all in Hindi, I decided to give this presentation in Hindi. So I it will be mixture between Hindi and English. It's just like we call it American language, for us. So let's begin with the slide presentation. I put it in English. If you don't understand, please ask questions and send question to Surinderji, and we will stay connected together. So let's share this presentation I have. I send you request to you for sharing a screen. Surendraji, you
Yes.
give me permission.
Yeah, already done that.
Okay. So let's forget about. I'm going to talk about just like this, which is not. So let's talk about this together, just like more like exercise. So in this people audience we have, how many people have thought about living next 50 years and then how they want to live, look like, how they want to be living in their own house, taking care of themselves, or they want to land up in the Vridhashram or somewhere nursing home. So what happened is, the question is right now you're alert oriented, you can take care of yourself. And so what action do you take now will depend upon how you be when you're 70, 80, 90 year old. So I know Surinder ji, he does daily yoga, he eats sattvic food, and he's nice to friend, and he does things like what you're doing. These are like relationship among friends, and I can guarantee that he has not checked his LPLA, he has not checked his ApoB, he had not checked his LDL, and you all should do that. So what I want to tell you today, even you're very healthy, if you're doing great, you can do everything you want to do. But if you don't take the advantage of modern medicine, then you basically missing out. So everybody on this audience today, if they have not seen a doctor in last 1 year, okay, then you should see a doctor. And then ask him, Doc, tell me what is my risk of having a heart attack in next 10 years. Ask that question. Now, if he doesn't, if he say, okay, you're going to live for 10 years, you got no problem, then you have to find another doctor, because that doctor need to really sit down with you, ask your habits, ask your diet, ask how what the family history is. Like in any family history has a heart attack or a stroke, then you have genetic component in you, and so then he should do the test. The minimum test we need to do at age 50 is you got to make sure your BMI, like how big you are, how small you are, should be between 80 to 25. Your blood pressure, should check it. Unless you check your blood pressure, you will not know. I'm just telling you that. And then blood pressure does not give you symptoms. It just hit you with a heart attack or stroke. So you should know your blood pressure, you should know your weight, then you should know what is your hemoglobin 1AC is. That's like whether you're diabetic, pre-diabetic, or whatever coming in next 10 years. So what you want to know is what's coming to you in next 10 years. Now, most Indian, like a lot of people, my family say, I'm feeling good, I don't need to go to doctor. That was okay long time ago, but not anymore. Now we have intervention, treatment, where we can reduce the risk of heart attack for next 10 years, next 20 years, next 30 years. So let's one more time. You need to know your BMI, you need to know your ApoB, it's a cholesterol particle. You need to know LPA. LPA comes from genetically from your parents. If it is high, then chances are you're going to have a heart attack or stroke in next 20, 30 years. But you could, if you know that is high, then you can do something about it and bring it down. Okay, so that I would like everybody to think like that. And if you have not thought about it, please think about it, and plan your life at least 30 years from now, 10 years from now, 40 years from now. I can tell you about me that I'm planning to live to 100, and I want to celebrate my 100th birthday at the Empire State Building in New York. So at least you have a plan, is that right? You have a plan. So you all invited if you're going to be there. we So that's one thing. The second thing I want to talk about is what we do during the day is very important for the rest of our life. Like Anand May Jivan is really put it all that together beautifully. So you gotta Anand May like the food. I think in Gita Gyan, Surindarji had read very beautifully put it together that the food is your medicine. Really, truly, food is your medicine, and this has come from the ancient Indian culture that you eat, you what you're eating, that what you become. The food becomes you. The food becomes your body. Food becomes your brain. So the important thing is what you eat, how you cook, how you cook. With you put more love into it, more nature into it, and then you eat right. You put masala in it, and then eat it with your friend and family. The food is really important to your medicine, and then live with time little bit time to meditate. Why? Now, why is going to important? This is ancient Indian culture and science, and it has now we know, clinically know that meditation improve your sympathetic and parasympathetic balance. It's so simple thing like eat right and then little meditation, and then let's put sugar in your language, how you talk to the people, how you perceive the thing, and that also that helps your heart. I'm talking about heart. That helps. The heart is not only a pumping chamber. Heart respond to stress, it respond to emotion, it respond to love, it respond to your food, it respond to your sleep. So all thing what I'm telling you, you know it. What you need to do is every day at the end of the day, like Sundarji said, when you go to home after work, sit down, spend 20 minutes, do the meditation. If you want to move your body, do some more body movement. And then after that, you have a meal with your family. So that all connected with your heart. Now, let me tell you what's happening in India. India is a big country. It's at 20% of population, but the number of heart attack, the 60% of the volume of the heart attack occur in the whole world happen in India. So 20% population, 60% heart attack. And what's happening? Our lifestyle, the way we think about it, the way we avoid the regular checkup screening, that's why it is increasing size. The other thing is I can tell you, like, I can guarantee you that you will have somebody in your knowledge base, on your contact base, that somebody died from heart attack, sudden cardiac death every year. You will know that. So the sudden cardiac death is increasing in India, and basically the reason is that the people don't know CPR. Only 2% of population know CPR. Now, it is very easy to learn CPR. Now, if you don't have a school, you don't have anything, you go to YouTube, CPR. And please promise me today that if you don't know CPR, you're going to learn CPR at least in the next couple of weeks. Simple thing: how to call for help, how to compress, how to give a breathing. You can save somebody's life just like that. So once you learn it, you will develop confidence, and then you will able to save somebody. So only 2% population in India know how to do CPR. And if you have sudden cardiac death in India, you have less than 10% chances to survive compared to 20% in US, because I think this country has put a lot of money, a lot of effort in training people in CPR. So the risk is high. Um, Surviving heart attack in India is also high. So what we can do about it? We need to avoid it. That learn to combine the Indian culture with advanced science. Advanced science is, as I told you, that you need to have blood test done. You want to make sure your urine test at least once a year. Urine test, and it's simple test. So now we emphasize everything on heart, but the heart cannot work without kidney, and it cannot work with the liver. But kidney is really getting there, where kidney function continue go down as age goes down. So easier test is when you go to your doctor, ask the doctor what my kidney functions are. It's called GFR. What my GFR is. Normally it's 90 or plus. If it's low, then you got to be careful because you want to keep your kidney working till you die. So if you're going to live another 30, 40 years, you got to make sure your kidney is good. Otherwise, bad thing can happen to you. So if you have a heart attack already, or you didn't have a heart attack, if you have angioplasty or you have bypass surgery, so what can you do? So key is you already have atherosclerosis. You know that atherosclerosis continue to get worse over time. It's going to progressively going to get worse. So what can you do? The modern medicine tell you that if you discipline, then be happy, you eat right, you keep your cholesterol down, you can reverse your atherosclerosis. You can reverse your soft plaque. It can decrease, it can decrease, or it can get better. So you should basically make sure once you already know you have atherosclerosis, then you should work on it to slow it down or reverse it, or at least if you have symptoms, you should take care of right away there and there. Then the other thing is like in your family, like my family, we have children, my wife, and so we have problems. So we make sure your kid your kid not going to listen to you, but make sure they check their cholesterol, check out, make sure at this age it's early. The early everybody need to know there is cholesterol, even when you are 20-year-old. Everybody know that they have a blood pressure high or low. If you ignore it, you can ignore it. Nothing bad gonna happen in next 5-10 years. But down the road, when you get 40, 50, you're gonna know you're gonna pay the price for it. So everybody now on this call should know what is your LDL is. LDL need to be less than 100 if you don't have any symptoms. If it's more, then you should do something about it. And be LP-A. LP-A should be less than 30. If it is more, then you do something about it. Hemoglobin 1AC, it should be 5.7 or below. If you have high, then you do something about it. If you wait, your waist circumstances, if it is more than 90 centimeters, then you should do something about it. Now, if you don't do anything about it, nothing bad going to happen in a year or 2 years, 3 years, 4, 5 years. But down the road, in when you get 670, 80, you will be slower, you'll be more fatigued. You will not able to do what your friend can do. And you then it will be too late. So we have a lot of people here, and I'm glad, Surinderji, you did a great job here. We have only let me see what else we don't want to talk about. The other thing is, um, well, everybody knows that being mad, get upset, and anger is a way to tell your heart, listen, I'm going to kill you. So if anybody want to kill somebody, if they have a heart attack or anything like that, get you upset. So control your anger, control your response to people who are upset it, and to make sure so the heart is connected with the stress. See what stress does is increase your epinephrine, and epinephrine affect your heart, it constrict the vessel and cause the heart attack. So that's another thing we need to think about this. The other thing is genetic. In your family, if you have father, mother, brother, sister had a heart attack or stroke, so you have genes, and genes are very, very important. Genes will, even you do everything right, you eat right, exercise, do everything, genetically you still remain high risk. The only thing you can do about genetic is knowing that you have genes, knowing that you have genes, knowing, then you need to know your how your LPA is, how your cholesterol is, and then you take precautions because somebody has in your family something. So you don't want to go in that route. So suppose somebody has bad genes and they smoke, they have high blood pressure, they don't care, and they died at age 50. Okay. So if you know that, and you have that information, and then say, I'm going to take care of you, I'm not going to smoke, I'll take my cholesterol, take your blood pressure, I'll get my weight control, then you're going to have a heart attack when you're 100-year-old, but you're still going to have it. So you can modify that. Then modify your genetic prediction for heart attack by changing your lifestyle. So the other thing is, let's talk about how you differentiate between heartburn and heart attack. So let me tell you the way I say it. Anybody who is having heartburn is having heart attack because I've seen so many patients who come in. So listen, I had chest pain. I thought it's a heart attack, and I have to do angioplasty and put a stent there. So first time, you have any chest pain and the burning sensation or anything, that is heart attack unless proved otherwise. Okay. Then, if suppose somebody said the heartburn, oh, it comes after food, it give you acid taste in your mouth, and you get worse by lying down. If that is the case, then you know that's heartburn. Okay. The heart attack is basically burning sensation in chest, associated shortness of breath. Sometimes you get sweat, sometimes radiate to your jaw, to your arm. That is heart attack. That's called 911 right away. You don't have to call 911. I'm sure it's available in India too, and here, or ask for help. At least tell somebody that I'm having problem. Don't keep it to yourself. You declare I need help, and that little thing can help you significantly. So, what common myth talk about is that a lot of people think that women don't get heart attack, and that's not true. We used to think that way when I was in school, medical school, that women don't have a heart attack, they don't get cath, they don't get treatment, they don't have bypass surgery, and because the woman disease in women, this disease is different than in men. In men, it will have chest pain. In women, it will be fatigue, tiredness, some pain maybe somewhere else. So, and not only that, women in the taking care of family, they ignore their symptoms, and they basically don't ask for care, help until it's too late. So, if you're a woman, if you have symptom, don't keep it to yourself. You tell people you need help. So, what I want to say to you is that we are responsible for our health. God will help us, but we're responsible for our health. Our behavior determine how we're going to be in day-to-day life. And when you reach age 50, nobody going to tell you what to do because you're not going to listen to anybody. So you got to really decide that how you want to be next 30 years, 40 years. That's what I tell my patients. So what you do now, I'm glad you're here. I can tell you your risk of having heart attack, stroke. And if you do this, this will happen. If you don't do this, this will happen. And then people make choices. We all making choices, sometimes good choices, sometimes bad choices, but that's fine. That happened 50 years ago. But now let's look forward. Look forward. How are we going to live our life? Are we going to make friends? Are we going to get upset with our neighbors? Are we going to eat sattvic food? Are we going to sing karaoke and have a good time? So these are the things, more things which will determine your health, your heart health. Heart is, it's not block arteries. Heart disease is not only block arteries. Heart disease is basically balance in your life, which affect your heart health. So let's talk about medicine. So a lot of people believe that statin are bad thing. Okay, so sometime because of the way your body made up, the body respond to statin differently. If your cholesterol is high, you take a statin and it doesn't suit you right, like you have cramps and pain, you can stop it, you try something else. But statin by study have saved millions of lives. So we believe that it's not the statin, it's the cholesterol we are after. So anything which help reduce your cholesterol, whether statin, whether diet, whether injections or available, whatever it takes, that need to come down. And right now, if you have no coronary artery disease, no atherosclerosis, no blockage, then your cholesterol should be LDL cholesterol should be less than 100. If you have blocked arteries, you have bypass surgery, you have a stent, or you have a carotid artery scan which shows the blockage, little tiny blockage, that means you have atherosclerosis, then your LDL need to be less than 50. That's what I tell people to keep the risk off. So to find out whether you have blockage or not blockage, whether you have atherosclerosis or no atherosclerosis, the easiest thing to do is number one is carotid scan, which can show you the state of the health on the carotid. Second thing you can do is a calcium score, coronary calcium score. And this is basically simple test. You go to do the scan of your chest, and then the scan can identify the calcium in the coronary artery. And then depending upon how much calcium you have, you can see how bad your atherosclerosis is. And then third thing will be just do a CTA where they inject the contrast and check your artery blockage. So that's the way to find atherosclerosis. Sometimes atherosclerosis is basically is the deposit of cholesterol inside the arteries. It can occur in your heart, it can occur carotid, sometimes it can occur in abdomen, sometimes it become leg. And basically, if you smoke, then the atherosclerosis go very fast. So now I think smoking is coming down everywhere. Hopefully, none of you smoke. If you smoke, then you need to ask for help to quit smoking. And I used to smoke when I was in medical school, and I thought I can hide from people. When I become doctor, then the patients start telling me that. I said, then it's time to quit smoking. So if you smoke, it's time to think about, and there are help available to quit smoking. The other thing which is very common is that the diet. We still don't have control on diet. The portion control is important. Then, if you think you are overweight, you think, not other people, you think, then you should make effort to do something about it. Now, if you're happy with your weight, then don't let anybody tell you anything about it. You're the one who decide, not some anybody else. You're the one decide how you want to love yourself rather than somebody else. So I even being big is not bad as long as you can handle it. Being a very very small is not bad. So unless you can handle it. So the way you look to yourself, that's the most important thing. Let's see. The other thing is number one factor which help to improve the quality of life. This study came from multiple sources like Blue Zones. Other studies shown that number one factor which determine the quality of life is making friends and stay connected with friends. So now it's not food, it's not blood pressure, it's not cholesterol, it's not smoking. It's number one thing is making friends. So stay in contact, stay together, with the stay connected with the YouTube and Zoom. And this is fantastic. Being together is making new friends. It's awesome. So basically, heart care is a is a process. It's a process, it's a journey, and you are on the driver's seat. And if you want to stay healthy, it's your choice. Your family member will tell you, but at age 50, you probably know you're not going to listen to anybody. I mean, I have a son. I can't even tell him that he need to lose weight because that's his dad. I know it. I can handle it. So stay happy, stay connected. Check your indicators of having risk of heart attack. I can re-emphasize again and again and again. If you don't know your LDL, if you don't know ApoB, if you don't know hemoglobin 1AC, if you don't know about kidney function, you don't know about BMI, it's time to do it. Please do it. Plan your next 50 years. Plan your next 30 years. So we all want to die, is that right? So why not just live till we die? Live our life the way we want to live till we die. So once again, I'm just trying to tell you, if you have not gone to the Gita Gyan from Surendraji on this Anandmay Jivan, please go through it. It's just beautiful. Thank you. So if you have any question,
Mhm.
so
So
I think I cover all your questions. If you have any question here, please go ahead and ask now.
can I ask a question for my wife? She got a
Sure.
high blood pressure. How can we just work on that?
So then let's say if suppose somebody come to me who has high blood pressure, well, how
Mhm.
I first I take detailed history, then make sure they don't have sleep apnea, make sure the kidney functions are normal, and make sure that this hypertension is what we call primary hypertension. There's no reason for it, and then at least I will take the blood pressure twice a day, in the morning, in the evening, after resting 5 minutes. Write it down and see blood pressure how often it goes more than 140. So
Uh-huh.
so the blood pressure goes up and down, up and down. So one reading is not good enough. You need to have about at least for about 10 readings, and it's
Mhm.
consistently up 140, then you know you have hypertension. And
Mhm.
then you need treatment. Treatment start with the salt restriction, diet, exercise, and then some medicine.
Yeah, her HDL came 43, which is seems low. HDL.
143,
No, just 43.
43 blood pressure.
No, HDL.
HDL, perfect.
Uh,
HDL 43. Well, the more we have, better it is. But right now, people would talk more about LDL than HDL. Anything HDL more than 45 is good.
uh-huh. What about the potassium? Potassium came out 5.6, which seems a little high.
No, no, that's high. That means either are you taking potassium? You
Mm,
take any medicine which can increase the potassium? And
no, she's taking metoprolol, which is for supposed to be for blood pressure. That's all she's taking.
so I would check the kidney function. That means the urine for albumin. I'll
Uh,
check the creatinine, and and then repeat the potassium. Sometimes potassium. If you don't do right, you can hemolyze and can increase your potassium level. So just repeat potassium will be helpful.
okay, yeah, will do. Working, work in progress. Yeah, right now. Yeah. Mm. What is this TSH? TSH.
TSH, thyroid stimulating hormone. Then basically it is a hormone which stimulates the thyroid to create thyroxine. So usually, if it is low, that means your thyroid working too high. If it is high, that means thyroid is not working good enough. So anything between, I think, 3 to 5, 6 is normal. Anything below three is hyperthyroidism. Anything above 6, 7 is hypothyroidism.
Yeah, it came out 5.06. That means it's 5 basically.
Yeah. Now
Yeah.
then you have to see your T4.
Yeah.
T4 and thyroxine. T3
Mm.
so T4 and 3. So you take TSH, T4, T3 and put it together and see whether the thyroid function.
So, Surin, Subodh uncle, we have few questions from the group,
Sure.
and I think we have already shared. Shiv uncle, आपके सारे questions हो गए या अभी और
Fine, done,
पूछना है
done.
तो?
I'm okay. I'm fine. Thank you, sir. Thank
अच्छा,
you.
अच्छा, no problem. Okay. So, uncle, पहला question है, if you could design the ideal heart health day from morning to bedtime, how would it be scheduled?
Very good. I think I would just follow what Surinder ji do. Every day you get up in the morning, do your down, have have low carb breakfast and go to work, be happy, do some good work, come back home, do and have a sattvic lunch, and then come home and back do dhyan, and then you get up and you spend some time with your wife and have dinner and then praise the Lord and pray and then go to sleep. That's a perfect day for you.
And those who don't have wife, what they need to do? Sorry.
They need to think about it. So
Yeah,
they
we
need
have
to
Okay.
they need to tell. This is a very good question. People who don't have wife, what they do, they need to know why they don't have wife. They
No,
got
I'm
to be
just,
reason. The
no, I'm
second
just,
thing is, do they have?
uh,
I think this is a very good question. If you are 20 plus and you don't have a wife, then you need to figure out why don't you have a wife. Are you waiting for um, God giving you a wife, or you going to find somebody, or you waiting for your parents to find one, or you have enough heart to call, ask for it, or you are you introvert, extrovert? All those things need to be figured out. And then once you determine you're ready, tell people I'm ready, and then
okay.
love will find.
There's a next question that was on a lighter note. So, which cooking oil is considered the healthiest for the heart and overall well-being, and why?
The cooking oil which we recommend is olive oil, sarson oil. These are unsaturated fat. The ghee and dalda ghee is not recommended. They are saturated fat. And the olive oil is basically the more you eat, better it is for you.
Okay. Um, so the other question is more philosophical. How do stress, loneliness, anxiety, and emotional well-being affect heart health compared with factors such as diabetes and high blood pressure?
So I think, in my opinion, the stress is more important, worse than the diabetes or hypertension. So if you have a stress and you're not getting treatment, so because it's constant, stress creates epinephrine, stress creates bad chemicals in your body, and that make you unhappy, that make you less functional. And then what is the opposite of anandmay jivan? You go into that jivan, which we call it dark side, and that is constant problem, and I think that's the worst thing than diabetes and hypertension. But if you have all three, then you are really in trouble.
What is the role of cortisol in this cortisol and insulin hormone? Because I think that is also creates the entire body is even diabetes, stress, and everything is driven by this insulin hormone, which most of the doctors don't even try to measure or test. So, what do you think about insulin hormone and cortisol?
So the stress, what it does, it increase your cortisol level and also develop insulin resistance. So the body, the muscle cell forget how to use insulin. So what insulin does, it help sugar go into the body, in the muscle, so sugar can be utilized. So what happens when you get high cortisol or stress, those receptors don't work. So your cortisol level goes up, your insulin level goes up, while your cells don't get insulin. So cortisol, most doctors don't check it because it's very variable. So in the morning, cortisol level is important. Then in the evening, it goes down. But if you uh, if you wanted your doctor to do the cortisol level because you stress out, he will do it. I do it, and basically, if I can talk to you and you stress out, I know you're stressed out. I'm going to talk to you and take care of that kind of problem, and maybe give you medicine, because cortisol is you cannot treat the cortisol. You need to treat the cause which causing the cortisol level elevation.
And I think the solution to that is doing box breathing, which is nothing but alom vilom. Like, I think that's what I want to tell the group, that if we have to reduce the stress level, which everybody's saying that we will have stress for sure, the best is to do uh, this box breathing. And this is one thing which is taught to all the armed forces professionals, because when you are in stress, which they are most of the times, they are told how to do box breathing. That is, you take 4 seconds of breath, and it can be of any frequency, 4, 6, 8, but you breathe for 4 seconds, hold for 4 seconds, release for 4 seconds, and then hold again for 4 seconds before you take a breath. So do 10 times, and that can help bring your cortisol level right away. So
No doubt about that. That's our, yoga, whatever you like, down,
yes.
anything you do, anything you do which is consistent with yoga and meditation help you.
Yeah.
In fact,
The next question is, Uncle, how important are genetics in heart disease, and to what extent can healthy? And I think that's where you were talking about lipoprotein A test.
so yeah, genetic is more important than anything else. If you genes have um, chemicals production which cause atherosclerosis, you're going to have atherosclerosis. And genetic effect cannot be can be until we change the genes. We are working on it. I didn't talk about it, but we are identifying genes who, and then we trying to take those genes out, put it back. And right now we are in rats. In the rats, we are successfully able to take the genes and change them. But if you have a family history of coronary artery disease, okay, like father, mother, brothers, sisters, close link, then you have genetic material in your body which prone for atherosclerosis. The only thing you can do is identify that, like LPA, LDL, hemoglobin 1AC in urine, and modify that by your lifestyle. So if
What is
you,
the role of niacin in this, Uncle?
okay, sure. The niacin is a vitamin B3. It's a great drug and great medicine. It's a vitamin. It's a food. I think everybody should take that. So niacin decrease the LPA. It also improve a lot of multiple things. The only problem with niacin is the niacin which work is the immediate release niacin. And then if you take that one day and don't take other day and then take the other day, then you get flushing. And then a lot of people don't like that. That's why they don't. Niacin, I think everybody should take it if they can take it. I take niacin every day. Niacin is good material. Is healthy. It's healthy for vascular health, and it decreases the LPA. And the only problem is how to manage niacin. If you take niacin every day, then flushing goes away. But if you miss niacin 2 or 3 days, then next time you take niacin, you're gonna get flushing. And some people like flushing, some people don't like flushing.
Okay, Uncle, the next question is, how can a person differentiate between symptoms of acidity and those of a heart attack,
Sure.
and what to do? I think you touched about CPR, but how do we identify the symptoms?
Sure. Then when the so, what I say, I've seen so many patients who said, "Listen, I had a heartburn, and I I thought this heart attack was my heartburn." So every first time you get first time heartburn, like a feeling of burning sensation with the acid taste in your mouth, which get worse when you lie down. That's more towards the heartburn. and the chest pain, burning sensation radiating to left arm, associated with shortness of breath, and sweating. That is, you are having a heart attack. But a lot of time people don't identify that. So if you have heartburn or a heart attack, it is heart attack unless proved otherwise. So once you have the heartburn, you've been checked out, then you can write it off. Is I mean heartburn, I can take care of it. But what I say is, if you have a heartburn, and just writing it off is a heartburn, is not the right thing to do.
Okay, Uncle, the last question is, can a person know in advance if they have blockages in the heart arteries, and which screening tests are truly useful? I think if you can, we can take down the list from you, which we can give it to all our
Sure.
lab tests. So if you can share that list with us, and then maybe everybody who is in India can talk to their doctors, and everybody in US can talk to their PHPs to get that tested as well, or included in their annual exams.
So what I'm going to do, I'm going to send the presentation, which I couldn't share with you. I will
Yeah.
send it to Surendraji, and then he can blast it to everybody. So let's tell me what everybody need to know at age. I would say 20, but at least by 50, that number one, what's the total cholesterol is, how the LDL is, how the LPA is, and how the ApoB is, minimum. And then they need to know if high sensitivity HCRP, which is the indication of inflammation. And then they also need to know their BMI is up or down or within normal limit. They also know their hemoglobin 1AC, and they also need to know whether they have albumin in the urine. These are the indicator which, if you have abnormal, the patient will not complain about anything. So he'll say, I'm happy, I'm doing everything, I don't need to go to the doctor. But that guy need to go to the doctor to find those things, and that because that person risk of heart attack depend upon the indicator which I told you, and that person may drop dead in 5 years, in 3 years, in 2 years. Nobody will know. So what I'm saying, at this modern medicine, where we know these are the risk factor, we should really. It's just like driving car without a gas or driving car without oil. So we know the oil make car run better. Why not we put oil in it? We know that checking your tire on a car make the car run better. So let's do it. So we didn't know this about 100 years ago. We didn't know about these 50 years ago. Now we know it. So let's do it. So I think coronary calcium, one time at least you need to do it. And if it is abnormal, then you need to follow through. You need to do ApoB. You need to, if it's high, if just LP-A, you just have to do one time. If it is normal, then you know your genes are okay. Don't need to worry about atherosclerosis from parents. If it's high, then you need to follow through and fix it.
Yeah. So that's all, Uncle, from our side, all the questions. But one thing which everybody should know is that if you really want to know what about your, because what is your genetics, then do definitely get lipoprotein A tested, because that's the only one of the measurement that can show, as Uncle was talking about, whether you have a risk, how big is your risk of heart attack in your family. So usually doctors don't test, but then it costs hardly $30 to $40 on just one test. So, but it's a very big test, and it helps really in the long run. So thank you, Uncle. That's all are the questions that we got. But if anybody has more questions, please feel free to ask.
बहुत बहुत धन्यवाद डॉक्टर साहब.
बहुत
It
बहुत
was
धन्यवाद,
it's
बहुत
really great.
Yeah. Thank
Thank
you.
you very much.
Thank you. Bye-bye.
Okay.
एक प्रश्न
Thank
है
you,
कि अगर
thank you
किसी
very
को
much.
हाँ एक प्रश्न
Chandra
है
ji,
अगर
thank
किसी
you.
को हार्ट अटैक आ जाए और पता चल गया कि हार्ट अटैक आ रहा है तो फर्स्ट थिंग मतलब बिफोर द एम्बुलेंस कम्स
Very
हमें
good. Very good. This is very good question. So you know you are having a heart attack, and you call the ambulance. Ambulance not there. What to do? That's very good question. You have to wait for that long to ask that question. First thing is, if you have nitroglycerin with you, take nitroglycerin. If you have aspirin, you take aspirin. And if you don't have aspirin, nitroglycerin, make sure you tell somebody that you have a heart attack, and then sit down and you start doing breathing, what we just, people said, deep breath, yogic breathing, like you take 4 minutes, wait, that start doing that exercise, and all that will be very helpful. Matter of fact, if you start doing, take deep breath, hold and breathe out, take deep breath, hold on, that will significantly improve. And then start praying. Get the stress down. The thing will go down. Then the Lord decide whether you live or die. Is that right?
Thank you very much.
Thank you.
Any
Well,
more questions?
Surinder, I
Tani?
want to thank you. You did a great job. Always keep it up, and please help everybody. Help him to grow this Anandamay Jeevan. It is just beautiful, and
So nice.
very nice, very nice.
Namaskar, sahab. Namaskar.
Namaste, everybody.
Namaste.
Good night.
Namaste. Thank you. Thank you.
Thank you.